The next set of exercises, which to me are really a prerequisite for any foot problem at all, is in the hip. If your hip isn't firing, then if your hip isn't firing properly, then your foot has to do more work. You need to be able to lift your leg up. If you can't lift your leg up from the hip, how are you going to move from here to there? You're going to have to use your feet more. And the feet can only handle so much. And when the feet can't handle it, then they start to hurt. But the problems oftentimes will start up in the hips. So whether the rolling, whether you have a hip problem or not, the rolling of the hips is a really important way to improve the function of the muscles that cross the hip joint, allow us to be stable in posture, and allow us to move better. And then ultimately that can only help your feet. So the area I really want to focus on the most is going to be so this front area is a muscle called, the origin of your quadriceps is your rectus femoris muscle and tendon. And so right up and through here, right below the hip bone and in the front. And as we work towards the outside, we have the tensor fasciae lata, or TFL. That becomes the IT band. That's the real area you want to target when you have an IT band problem. So when your hips are out of alignment, which oftentimes they are, we end up not using our hip flexors, which are actually up here. We end up using our quads for flexing our hips and extending our knees. Our quads then get kind of overworked and tight, and they can't do their job anymore. So then the TFL, which is this little muscle right here, ends up doing more work than it should, and then it gets tight and people get IT band problems. So that's why you really want to go from here to there. And then lastly, your gluteus medius muscle. That's your hip stabilizer. If you can't stabilize your hip in single leg stance, when you lift up one side, if you can't stabilize your hip, then your knee's going to drop in and you're going to land in a different spot with every step that you take. So it's really important to get all these muscles relaxed and working as well as they can work. So for the rec fem, I just put this right in front of my hip and I just lay on it. And you don't really need to move or do too much because it almost will immediately hurt if you need it done. That's the other beauty of foam rolling. If it doesn't hurt, then you don't really need to spend a whole lot of time on it. If it's really hurting, you should probably spend more time doing it. But just little movements back and forth, and then I'm just going to work my way. Now I'm on TFL. Oh, when I feel it. And I'm just kind of walking around. You might have to take a little time getting the coordination. Right here, I'm still in the front of my hip, so I am smack dab center in my TFL. I'm right here, and I've been doing a little bit more running lately, and so I definitely feel my TFL a little bit more. So that spot, I'll go on this angle, you can see me cringe, but right about here, oh yeah, that's the spot that's going to, need a little bit of time and patience. And this is the spot that a lot of people will get to, and they will immediately get tensed up. They might start sweating. You might clench every part of your body. And it doesn't do any good to start rolling over clenched muscles. So what I'll sometimes do is I'll call it playing dead. I just sort of relax everything. I just let everything kind of go limp, and I'll wait until I can sort of unclench and relax all the muscles. And once I'm there, breathing, I can feel the muscles giving, and then I'll just move a little bit. And if it's too painful to move, then I'll just stay there. And sometimes I'll just rock on it. Sometimes I'll move my foot on my leg, the leg that's on the muscle, and then that's enough. And then the glute med is going to be the backside. So the glute med, you're just sort of sitting, lounging, kind of relaxed, nonchalant, and you just sort of move back and forth a little bit. So this is glute med, and as you work higher up, right into the top, then you're going to feel it, because the gluteus medius works all the way around the hip, all the way towards the sacrum, sacroiliac joint. So this kind of side to back, which takes us right into the piriformis, which is on the back side. It's a hip stabilizer, also very important, and it's like in your back pocket. So you kept a wallet in your back pocket, that's right on your piriformis, and you find that spot, and you angled a little bit on top of it, and then you just let your leg drop out. And you can do this, say, 10 times. And this is a really good way to foam roll the piriformis. The ball here is extremely effective in the hips too. So if you find that the foam roller isn't getting deep enough, this will light some muscles up. This is a really, really good way, especially in that TFL or piriformis or glute med. This is like a 280-pound bodybuilding massage therapist getting their thumbs in there. This will definitely do the job. Last part of the hips that's really important would be the hip flexors. The hip flexors are actually right next to your belly button. So this is my belly button. So my left psoas is here, my right psoas is here. These, when working properly, flex the hips. So bring the knee up by flexing the hip. The psoas or iliopsoas originates on the spine. So you need a stable spine, i.e. you need a stable core to properly utilize the hip flexors. People that sit a lot, these things are chronically tight. So it's really important to do something to try to get these muscles to relax. The best way to do it is a bigger ball like this, because you're really not truly going to get down to the psoas using a massage. Even the massage therapist that can get close, they're not on the psoas unless you're super thin, because there's a lot of important visceral contents and intestines that are down here that sort of have to be worked through. But you can definitely get an effective release of the iliopsoas through massage or through trigger point rolling. So again, I put my belly button just to the inside of the ball, and what I'm going to do is lay on it and just rest for 10 seconds. As I exhale, I'm going to feel the ball setting in even deeper. And when I get to about the deepest it can go, then what I'm going to do is I'm going to combine a belly breath with an inhale through my nose. And when I exhale, I'm going to extend my upper body and my leg, kind of like a cobra pose in yoga. So. For anybody that's had psoas releases, this hurts. So it's okay that it hurts, but it should be a good hurt. It should not be a bad hurt. And afterwards, if you want to test out if you did it right, try just standing and lifting your leg on the side you just released versus the side you didn't release, and it'll feel like you got lead on one side and it's light as a feather on the other side. So that's how you release the hips.